and we've had so far over 100 deaths in Maine from overdoses and relations to drug problems. So this is a real problem, a serious one, that is confronting us throughout Maine, in the urban areas, in the rural areas. It's confronting families. It's confronting the medical community, the law enforcement community.
You know, I can say unequivocally this is our #1 issue at the Office of National Drug Control Policy when you look at all the data. But, you know, the senator's right. You know, the numbers become overwhelming sometimes. And, you know, all you have to do is listening to the stories of parents who have lost a loved one to this issue. You know, so it always, so the numbers get staggering for me, so I keep these in my pocket every day. And so these are 2 funeral cards of people who have overdosed and died. Because it's my touchstone. It makes me say, what am I doing every day to make a difference in the lives of parents who are affected by this issue? So let me talk a little bit about what we're doing at the federal level and then hear from you. In 2011, we released a prescription drug abuse prevention plan that had 4 main pillars. One was prescriber education. I think we all know that we want to make sure that people are adequately treated for their pain. But we are over-prescribing prescription drugs in such a magnitude that in 2012, we are prescribing enough pain medication to give every adult American 75 pain pills. And so part of what we've been calling for, and we're working in partnership with Congress, is mandatory prescriber education for every prescriber.
Our son Brendan, he passed away in December 2013, shortly before his 23rd birthday, an overdose of heroin. And I can certainly answer questions if there's more I should say. He did have a fair amount of treatment before that. He was in the methadone clinic and relapsed, and then he went out of state for treatment, and he had 6 weeks of inpatient and then 90 days of residential. But as all of you know, relapses are common, and that's what happened with Brendan.
Before I had this personal involvement, I, as maybe a lot of people, had kind of an arrogant kind of attitude about this problem. I think what Congresswoman Pingree mentioned, you know, is it just couldn't happen to a family like ours. Very highly educated. Our kids, you know, Brendan's twin brother just got his master's in robotics. Katie volunteers at the Needle Exchange program. We have really wonderful years. We need to talk about it. We need to please avoid blame. Addiction is, as I have found, an incredibly powerful force that transcends education levels. It transcends every segment of society. It can happen to anybody.
It's amazing how much the public needs to be educated. I think within the treatment community, people are educated, but public stigma, judgment and stigma are so profound that that is an obstacle to treatment.
There really has been a sea change in law enforcement. It's not, in most circles anyway, it's not just arrest everybody and put them in jail and lock them up. There is now more empathy for the user, and there needs to be, I don't think anybody questions it, more treatment available.
I will say that having this collection of important legislators and drug czar, etc., and the U.S. Attorney's Office, having them come out with the statements that they did today was like Christmas. They were finally saying the things that I've wished people were synthesizing and planning for a long time, and their willingness to listen and get new information was just incredible and very encouraging.
We do the majority of patients who are who are having pregnancy but also have problems with addiction or dependence to opioids. We are the referral for this whole part of the state, and we do the large majority of them. And many of those patients are very motivated and do well. My sad commentary is many of them have been looking for treatment well before they were pregnant, most of them for at least a year, and couldn't find treatment. And sadly, we're so full we can't take any more unless they're pregnant right now. which is, to me, a moral dilemma because I'm very frustrated. But we are so full, we're way beyond what we can handle as far as numbers and slots we have that we can actually take care of. And there's nobody else taking up that slack. So sadly, we're waiting until they're already pregnant to start treating them because that's when they, when we can, because we've said that's our priority at this time. But it's crazy that we have to wait for that.
The second thing I'll say is there's a low-hanging fruit as it relates to stigma. And all of us have a responsibility to change our language as it relates to people with addictive disorders. And no offense to any well-meaning folks in this room, but when we refer to people as addicts and junkies, it sends a clear message. We don't do that with other diseases. We talk about a person with a mental health disorder. We talk about a person with diabetes, and we need to really change our language because we're inadvertently continuing to stigmatize people and disease, even by the words that we use. So I just want to give a call to that.